Diolch, Prifynidog, and it's good you've mentioned Friend in Me, a great organisation. I fully welcome the Welsh Government's commitment to developing a national framework for social prescribing at a time when A&E and GP surgeries are under pressure. It's vital that we grasp every opportunity at preventative care. One example of where this is happening is at the Laundry Garden at Tredegar House, which is run by the National Trust. Members of Growing Space, a mental health charity, help care for the garden, while members of Woodland Roots to Wellbeing use the garden to gain skills and improve people's mental and physical well-being. And I had the pleasure of inviting you, Prif Weinidog, to see Growing Space back in 2021, so I know you've seen firsthand the excellent work that they do. This project in my constituency is an excellent example of using our past and our heritage to improve the well-being of the present. As a country, we pride ourselves on our castles, estates and landscapes. It would be fantastic to see more of them utilised in this way. Prif Weinidog, how are the Welsh Government working with partners like Cadw, Museums Wales, NRW and the National Trust to promote social prescribing projects? And how are bodies such as these able to work with NHS boards to ensure that frontline staff are aware of the local opportunities so they're best able to refer residents?
Well, thank you, Bryant, for that. And I've been fortunate enough to have a number of opportunities to visit Newport and to see the sorts of projects to which Jayne Bryant referred. In fact, I was with John Griffiths only on Saturday at the Maindy Triangle, where the Friend in Me project operates. And not only was I lucky enough to be at Tredegar House for the Growing Space project, but of course the member for Newport West invited me to the Road to Nature project, another example of where social prescribing, those non-clinical, community-based projects, connect people with nature in a way that we know to be so good for their own physical and mental health. So with around 20% of all GP consultations are with people who primarily have a social rather than a medical need for help. And what social prescribing does, it allows those people to be put in touch with that vast range of different services, befriending, book clubs, choirs, running clubs, community gardens, the National Exercise on Referral Scheme. The list goes on of things that people can be put in touch with, and if they're able to take up those opportunities, then it makes that long-term difference. What the Welsh Government seeks to do is to create a national framework where we have an agreed model, a common understanding and a shared language that promotes social prescribing even further. There's been a consultation on all of that, and the plan is to publish the final framework and an action plan to support it later this summer.